In this video, I'm going to talk about sciatica, which is that horrible radiating pain that can run down your leg, often from the lower back or buttock area and sometimes all the way into your calf and foot. It's one of the most common yet misunderstood problems that I see in my daily practice, and it can cause a whole lot of distress and confusion over what it is, what causes it, and most importantly, among the myriad of things we get told about how to treat it, what really is the best evidence-based advice to follow. I'm Stephen Bunting and I'm a specialist MSK physiotherapist based in the UK. And in this video, I want to dispel the myths and share my 30 years of clinical experience to help you understand this common condition and point you in the right direction for recovery. I'll also cover a few important warning signs that you should never ignore and how to tell sciatica apart from some of the other conditions that can cause similar symptoms. I know it's a long video, but hopefully it will be worth your time. So let's get started. Most people use the word sciatica to describe the pain running from the lower back or buttock right down the back of the leg, but it's actually not an accurate term. The sciatic nerve itself is a large nerve that runs from the buttock area down the back of the leg, but it's usually not the structure that's irritated in this condition. In most cases, the pain starts higher up in the lower spine, where the individual nerve roots branch out from the spinal cord before joining together to form the individual leg nerves, including the sciatic nerve. And when one of these lumbar nerve roots is pinched or inflamed by something like a disc bulge or a joint swelling, it can send pain, tingling or a numbness feeling down the leg along the same pathway of the nerve it goes on to form. The most common nerve roots affected arise from the lower two lumbar vertebrae. Irritation of the L5 and S1 nerve roots lead to that classic pain radiating down the back of the leg and into the foot. But the higher lumbar nerve roots can also be irritated. The L3 nerve root can cause symptoms in the front of the thigh and knee, and the L4 nerve root can cause symptoms right down the front of the leg, the shin, and can end up in the big toe. So as you can see, sciatica is really not an accurate term, but it's been around for so long now and it's understood by the general population, so it's still in common use. But as we now know, it's really an issue with the spinal nerve roots, which we also call the radicular nerves. And so the accurate medical term for this condition is lumbar radicular pain. Or if you have symptoms of numbness or muscle weakness, then we call it a lumbar radiculopathy. So the common symptoms that people often describe are a sharp, burning or shooting pain radiating down the leg. It usually affects just one leg, or at least one leg more than the other. Leg pain is the most common symptom, but numbness, tingling or pins and needles in the leg, foot or toes are also commonly described, and some people also experience weakness of the leg or foot muscles. The pain can vary from mild to excruciating. In the younger age groups, it's often worse with sitting, bending, or when coughing or sneezing, anything that increases pressure in the lumbar spine. But in the older age groups, it's often worse in standing and walking, and I'll explain why in the next section. So there isn't just one cause of sciatica. It depends a lot on your age and what's going on in your spine. In younger or middle-aged adults, the most common cause is a lumbar disc bulge, often called a slip disc, but again that's a very inaccurate term because it implies that a disc can slip in and out of place, but that's just not the case. Bulging disc material behaves a bit like toothpaste being squeezed out of the tube. It can't go quickly back in again. The discs between the vertebrae act like shock absorbers. Small bulges are really very common, and indeed most of us will have at least one small bulging disc somewhere in our spine at any one time. But sometimes a larger bulge can press on a nearby nerve root and cause symptoms. This might happen after heavy lifting, bending awkwardly, or sometimes for no obvious reason at all. The nerve roots lie close to the discs and they usually just sit there minding their own business. But if a bulging disc is large enough, it can put contact and then pressure on them. And the result is that the nerve root gets irritated, leading to that familiar pain down the leg. And because disc pressure increases in sitting and bending, these are the positions that will make the leg pain worse. I can always tell a younger patient with severe sciatica in the waiting room because they will be stood up. But in people over 60, the cause is often different. As we get older, our discs lose their sponginess and become thin and desiccated. These are normal age-related changes, just like having grey hair. And indeed, the combined effect of this thinning on all of our spinal discs is what causes us to shrink in height in our older age. Now, thin, degenerative discs don't tend to bulge like younger discs can, essentially because there isn't much left to bulge. So sciatica in older adults is instead caused due to spinal degeneration, things like arthritis, bone spurs, or thickened ligaments that gradually narrow the space around the nerves. This narrowing, called spinal stenosis, can pinch the nerve roots and produce similar leg symptoms. But unlike classic disc-related sciatica, the leg pain caused by spinal stenosis tends to come on when standing or walking, and ease when sitting or bending forward. Spinal stenosis can also commonly affect both legs and can really limit your walking distances. I've done a separate video all about spinal stenosis, which you can check out up here, or I'll put a link in the description below. It's important to realise that not all leg pain from the back is caused by sciatica, and one of the most common other causes is lumbar referred leg pain. This is a pain which originates in the lumbar spine, usually from muscles, joints or the disc, but it doesn't involve the nerve roots. Instead, the pain spreads vaguely from the back into the leg, but it doesn't follow a nerve pathway like in sciatica, and it doesn't usually travel below the knee. Also, in lumbar referred pain, you don't get any tingling or numbness, and the back pain is usually worse than the leg pain. Whereas in sciatica, the leg pain is often much worse than any back pain, and indeed you might not have any back pain at all in sciatica. I often describe lumbar referred pain to my patients as being similar to having left arm pain during an angina attack. The heart doesn't irritate the nerves in the left arm. It's just that it's wired up in a way that can cause the brain to misinterpret the intense chest pain sensation and be tricked into thinking the pain is also in the arm. Other examples of referred pain are the gallbladder causing right shoulder pain, appendicitis causing a spread of pain into the back, buttock or pelvis, and the brain freeze sensation that some people can get when eating a cold ice cream. So to diagnose sciatica, you need to be carefully assessed by a healthcare professional who will examine your back, look at the way you are moving and test the nerves in your legs. They may also request an MRI scan, which can image the spine in detail, including the discs and nerves. This MRI shows a normal spine in long view. You can see the nice, thick, healthy discs and the white fluid that bathes the spinal canal where the nerves live. This MRI shows a bulging disc at the L5-S1 level. You can see that it pushes backwards and is indenting the spinal canal. We need a top-down or axial view to see this in more detail and see which nerves are affected. Here is a normal axial view showing the disc and the nerve roots with plenty of room around them. And here we can see the disc has herniated backwards and to the side and is compressing the S1 nerve root on one side, which could easily cause sciatic pain down the back of one leg. Now, before we go any further, I do need to mention one serious but rare condition called Cauda equina syndrome. This happens when there's significant compression of the nerves at the very bottom of the spine, and it's a medical emergency. You should seek urgent medical attention, ideally go straight to the emergency department if you have the symptoms of sciatica and any of the following red flag symptoms. Number 1, a recent loss of bladder or bowel control, usually difficulty starting or stopping urination or incontinence. 2, numbness around the saddle area, which is the inner thighs, buttocks or the genitals. Number 3, sudden severe pain or weakness in both legs. Number 4, in men, a sudden inability to get an erection or ejaculate. Cauda equina syndrome is a medical emergency because the nerves that control the bladder, bowel and the genitals are very sensitive to compression, and indeed if they're severely compressed for more than a day or two, there is a risk that they may never fully recover, which can lead to a permanent loss of bladder, bowel or sexual function. So if these symptoms develop, then you need an urgent MRI scan, and if the diagnosis is confirmed, an urgent operation. Thankfully though, this is a rare condition, but it's something that every patient with back and leg pain needs to be aware of. Okay, well the good news is that most cases of sciatica will improve over time, often within a few weeks or months. The key is to stay active and manage your symptoms rather than trying to wrest your way out of it. The research tells us that about 90% of disc-related sciatica will settle down within 3 to 4 months. This is because disc bulges tend to reduce over time due to the body's natural healing processes. In older patients with stenosis, the prognosis is not quite as good. About a third will get better within 3 to 4 months, a third will stay the same, and a third might slowly worsen. It depends how badly the nerves are compressed. If the pressure isn't too great, then the nerve can adapt and toughen itself up so as to cope with the pressure. But if it's badly compressed, then symptoms might persist. We know that the longer the symptoms persist beyond about 4 months, the less likely they are to get better by themselves. So when I see a patient under 60 in my clinic with sciatica, they can sometimes be in a lot of pain and be quite distressed, and the first thing I do is to reassure them that although the pain can be horrible and stop them from sleeping, in about 90% of cases it will get better. There is a light at the end of the tunnel. We just need to get the pain under control and then allow the passage of time to heal the problem. In the cases where symptoms are more severe, or I suspect a larger disc bulge, then I will usually request a lumbar spine MRI scan. But I will tell the patient that in most cases, by the time I've got them scanned and then seen again in clinic, the chances are that they will be improving or better. So in the meantime, while we are hopefully waiting for nature to take its course, let's discuss what can be done to help with the pain. Number 1, stay mobile and keep moving. While it's tempting to rest, prolonged bed rest actually slows recovery. Motion is lotion, so as soon as you can, get up and start moving within your pain tolerance. Gentle movement, short frequent walks and light stretching can help reduce stiffness and keep blood flowing to the nerve and muscles. Try to avoid long periods of sitting, especially in low, comfy chairs. Standing up and changing position frequently can help ease the pressure on the nerve. Number 2, pain relief. Simple painkillers like paracetamol and anti-inflammatories, if you can take them safely, can be helpful in managing sciatic pain. Just make sure you take them regularly, and this is the key point. I see so many people in my practice who tell me that their painkillers aren't working, but when I ask them how often they take them, the answer is usually as and when they remember. Painkillers and anti-inflammatories work so much better if taken as it says on the packet. So if it says take 2 tablets every 4 hours during the day, then that's exactly what you should be doing. The drug can then build up in your system and then stay at an effective dose as you keep topping it up. It won't work anywhere near as well if you go beyond the repeat dose time and allow the drug to wear off and then have to start up again from scratch with the next dose. Many clinical studies have shown this, so take your meds as instructed. And if you feel you need something stronger, then speak to your doctor or pharmacist. The neuropathic drugs are generally better at controlling nerve-related pain, so do get professional medical advice and then make sure you take them as prescribed. Number 3, night pain advice. Not being able to sleep because of pain is a horrible situation to be in, but unfortunately it's a common situation with acute sciatica. Pain relief medication is important to help get symptoms under control, so do see your doctor or pharmacist, as mentioned earlier, if you aren't sleeping properly. Sleeping position is another factor that can help. For most people, sleeping on your side with your painful leg uppermost and your knees bent up in the fetal position is most comfortable. Using a pillow or a specialist cushion between your knees to keep them apart and in the same position can also be helpful. If you find it's more comfortable sleeping on your back, then try using a pillow under the knees to keep them slightly bent, which can take the stretch off the nerve roots. Number 4, therapy. Now, I'm going to be a bit controversial here, but I say this as an experienced physiotherapist who has seen many hundreds of patients with this condition. If you're in severe pain because of acute disc-related sciatica, then there is very little a therapist can do to you which will help. There is no evidence to support the use of manual therapy, spinal manipulations, things like traction, electrotherapy, acupuncture, or any of those passive treatments where a therapist does something to you. You can't influence a bulging disc by these things. You can't manipulate it back into place, despite what some practitioners will tell you. It's complete nonsense. And I know it's tempting to think that a chiropractor, osteopath, or a physio/physical therapist will be able to take your pain away with a magic movement, but it's just not possible. And indeed, these type of treatments are only likely to make things worse. In fact, over my career, I've seen many more cases of disc herniation patients being made much worse after spinal manipulation than I've ever seen improve. So my advice is to steer well clear of manual treatments if you have acute sciatica. I know it's a painful and frustrating condition, but time really is the best healer, and it's often best left alone to do its thing. While you might not be able to dramatically speed up your recovery, you can certainly slow it down by being overly aggressive and interfering with the natural healing process of the disc. Indeed, the research tells us that the only types of therapy that can help are the gentle exercises which respect pain. I'll go through a few of the simple ones just now, but I would recommend seeing a physiotherapist or physical therapist for exercise advice, as they can certainly help in this regard. Just don't let them start twisting and cracking your spine while you've got severe leg pain. The first 2 exercises are nerve sliding exercises, and this first one is a simple pendular leg swing. It's designed to do 2 things. The weight of the leg can help to gently distract the lumbar spine, taking pressure off the nerve roots. And then the pendular movement of the leg helps to gently mobilise the nerve. So just swing the affected leg like the pendulum of a clock. It should be a gentle, relaxing movement with very little muscle activity. You can swing a bit higher if you can without pain. The next one also slides the nerves. In sitting, start by just gently swinging both legs at the knee, like you sat on a swing. See if you can manage about a minute. If you can swing a bit higher without pain, then do so. To progress, on your affected leg, pull the ankle and toes upwards, and then slowly straighten the knee. This one is likely to reproduce some leg pain, so go easy and try to keep any increase in pain to an absolute minimum. Hold for a few seconds at the top position, and then repeat. Okay, so these next ones are aimed at trying to gently move the lumbar spine and reduce stiffness. The first one is done in sitting. The idea is to try and maximise your lumbar curve like this. Hold for a few seconds and then sag down and curve your lumbar spine into the opposite position like this. Note that my head is staying fairly still throughout the exercise. I'm not swaying forwards or backwards like this. Along similar lines is the angry cat, happy cat exercise. For this one, we are kneeling with hands under shoulders and knees under hips. Start by arching your full spine into the angry cat position. Stretch for a few seconds and then allow your spine to sag down into the happy cat position. Again, hold for a few seconds and then repeat. And the last basic exercise tries to work some of the main muscles around the lower back and pelvis. It's a simple bridge. Just lie comfortably on your back with knees bent to 90 degrees. Then slowly lift your pelvis off the floor into the bridge position, where your thighs and spine form a straight line. Hold for a few seconds and then repeat. Finally, if you can do this without any pain, then you could progress by doing a slow march in the bridge position. It's difficult to be too prescriptive with these exercises because if you're in severe pain, then you might only be able to manage one or two of them for a minute or two at a time, and maybe not even that. You really just have to try and see, but don't beat yourself up if you can't manage them. The best advice I can give is to try and keep any pain below about 4 out of 10 on a pain scale like this. And if it's already above that when you start, then try not to increase pain beyond 1 point and try to make sure it settles back down quickly afterwards. Nerves aren't like other tissues. They can be very irritable, but only by trying and seeing will you work out the right level of exercise for you. And then hopefully over time, when the pain starts to improve, you can then slowly start increasing the exercise intensity. But always respect pain, as you don't want to aggravate the healing nerve again and go back to square one. I'll link to a more intensive exercise program up here and in the description, but these should only be done way down the line when the leg pain is improving and mild, and then you can slowly start to return to your normal activities and sports, but the emphasis should always be on slow progression until you're fully better. And if you do get a relapse, which can sometimes happen if you push things too quickly and the disc bulge increases again, then just go back to the start with basic movements and exercises and painkillers and learn your lesson. If you've reached the 4-month mark and your sciatica is showing no sign of improvement, then you might have a larger disc bulge or a more severely compressed nerve. You might therefore be in the unlucky minority that isn't going to get better by itself. At this point, you're going to need an MRI scan to see exactly what's going on, and if a large disc bulge and nerve root compression is confirmed, then you might need to see a spinal surgeon. The two main treatments available are a nerve root sleeve injection or surgery. The injection tends to be offered if you have severe leg pain, but your scan shows a mild to moderate degree of nerve irritation. But if the scan shows moderate to severe nerve compression, then you're likely to be offered a discectomy procedure, where the surgeon carefully removes the part of the disc which is compressing the nerve. This is usually done under general anaesthesia and involves a small 1-inch long incision into your lower back. and the intention of the surgery is to help with your leg pain. It won't do much to help with your back pain, and so if you have just back pain and no leg pain, then disc surgery is not going to be for you. Okay, so to recap, sciatica is pain caused by irritation or compression of one or more of the nerve roots in the lower back. Younger people tend to get it from a disc herniation, whilst older adults more often have degenerative changes or spinal stenosis. It's important to recognise red flag signs like bladder or bowel changes or genital area numbness and seek urgent medical help if they occur. Most cases will improve over time, usually within 3 to 4 months. Keeping active, taking painkillers and doing gentle exercises are the most helpful things you can do. Okay, well that's about it. If you have had sciatica yourself, then please share your experiences in the comments. I'd love to hear from you. And if you found the video helpful, then please give it a thumbs up and don't forget to subscribe for more clear, evidence-based advice on musculoskeletal health. You can also visit PhysioMSK.com for more detailed articles and resources on sciatica and many other MSK conditions, including links to helpful products and exercises. Okay, well thanks for watching, take care and bye for now.